Welcome to Between Two Psychs, a podcast where two psychologists and board-approved supervisors deep dive into many of the questions and challenges that provisional psychologists and early career therapists face in everyday practice, during training, throughout the internship, and beyond as they progress into working more independently. Your hosts, Isabelle Tombleson and Claire Trevitt, talk about a range of topics, specifically relating to psychologists and therapists who are just starting out. Welcome back. It's Claire today, and I have got a guest with me. I'm so excited to have our very first guest on the podcast, Jo Canine from Guided Healing Psychology, who is here to talk to us about dissociation.
Yeah.
I'm going to hand over to Jo, and maybe you could start with a quick introduction as to who you are and what you do.
Welcome, everybody, listeners and watchers, observers. Jo from Guided Healing Psychology. I'm generally registered psychologist. I've been in private practice for myself for the last 5 years almost. I've published a few books, which I'll plug throughout the episode. But yeah, my special interest is dissociative disorders like DID and really complex trauma. And then an extra little fun niche is folks who have survived cults or really high control groups, which is always of interest to a lot of people.
Wow, so that's a lot of experience in this area. And from my experience, dissociation seems to be one of those areas that can feel a little bit scary for people. So yeah, I think having a little bit of an overview of what dissociation is maybe might help to, help people feel a little bit more comfortable when working with dissociation and identifying what it might be.
I find the idea of dissociation complex, but also very simple. As an observer, say, us therapists on the outside, it can be really hard to see unless it's extreme. And if we don't have that really solid understanding of what dissociation is, we might misinterpret things that are dissociative processes as maybe attentional issues like working memory or concentration issues. So for me, bias as well, because that's my area of interest, really understanding what dissociation is from the outside, like observing it as therapists, but also from the client's perspective, so that when we're listening, maybe in an intake or over time, we're able to hear those clues of this sounds more like a dissociative process than a working memory process, because they're very different. And if we think it's working memory, we might start doing treatment that's quite oppositional or maybe even harmful when it's actually dissociative, or the other way around, where we think it's dissociative, but it's actually just executive function, and then we go off in this other tangent. So for me, it's really important for all therapists to really have a confident understanding of what dissociation is.
Wow, so it sounds like it could be confused with a number of other things, another number of other presentations.
Very much so. Even myself, it's because it's a personal experience, like there is no assessment that I'm aware of. I'm happy to be corrected, but there's no assessment that I'm aware of that can objectively assess dissociation. So if we're like assessing or screening for dissociative disorder, they're all self-reports. So there's a requirement that we as therapists understand what dissociation is to make sure that the client is responding in regards to its dissociative process, but also for the psychoeducation. A person can't answer a question of dissociation if they don't know what it is themselves. So they might then misinterpret, and then the outcome of these things aren't accurate. And then again, our case formulation is not accurate, and treatment then is not accurate. So understanding, so for me, I think of it, if I like super simplify, dissociation is like one of our threat response processes. So it's deep distress or trauma based. And then we have the other stuff like attention. These are more executive function. So understanding at the basic, is there a potential for the dissociative or whatever process is going on, is this a response to deep distress? Which I then go, well, we can still have working memory issues if there's deep distress. Like if someone has ADHD, their executive function might be compromised more in deep distress. So then again, how do we understand? So dissociation would be a detachment of that connection to self or reality, like depersonalization, detachment from personhood or sense of self, or derealization, that detachment or disconnection from reality and what's going on around us. On an extreme level, it's pretty obvious, that's why it's extreme. I might be so disconnected with who I am as a person, I might have a dissociative fugue state. So if we've all seen, I hope we've all seen, if we've not, go watch it, Breaking Bad, where there was an episode where Walter used that to get out of committing a crime, but this idea of essentially moving to a totally different place and having no idea who I was before, and I have this new identity. So a fugue state, so I'm just totally disconnected with who I am as a person. If we look at it as maybe a bit more subtle, it could be dissociation from my experience of emotions. So a lot of clients might come in saying that they have a hard time connecting with their experience of emotions. That could be a dissociative experience. I'm numbing or disconnecting from my emotional experience. And so it's quite common because everybody dissociates. It's a human experience. So as a therapist, if we're working with humans, we need to, in my opinion, understand dissociation, because every one of our patients will experience dissociation. It's on a spectrum of, is it typical? Is it what we would expect for an average person who's generally well? Is it something like you would expect from PTSD? Or is it super pathological and fragmented, like what we would get from DID? And understanding what it looks like, so then we can kind of really harness where, with our case formulation, what do we do next? Because everyone we see is going to dissociate.
Wow, so you're saying that everybody, all of us, experience dissociation to some extent, but it's
Yeah.
like layers and levels, like a continuum of severity.
Yeah, like a spectrum, a line of the degree to which we dissociate. So dissociation's normal, and it's always helpful to validate that with client when we talk about it, because it can be scary when clients hear you dissociate. But understanding that, say you're driving and you drive to work every day the same route, we might get to the end of that and show up at work and go, oh, I can't remember the last two traffic lights or the last couple of blocks. That's not because we've had a fugue state or we've had a lobotomy. The brain is just disconnected from the conscious awareness of what's going on. It's no longer necessary. In that case, that's not deep distress and trauma, but there's no longer a function for me to be concentrating. So it could be dissociative, or it could just be attention concentration. So understanding which one it might be. So is it an attentional concentration? Is it typical dissociation? Which is really, if it's typical dissociation, people get sad, they cry. So we're not really working with normal presentation of dissociation. How do we know when it starts to become less typical? We need to know what we're looking at across the spectrum first.
Yeah, and it's so important, isn't it? Because, as you say, it impacts the treatment. If we
Yeah.
know what the presentation is, then we can provide the best treatment, because working with ADHD would be so different to working with dissociative identity disorder in terms of treatment. We want to get it.
Especially when it's so subtle at times that, again, it requires the client to have a knowledge or an awareness of their own dissociative process. So if I just ask, do you dissociate, and they say no, then I know they don't understand dissociation, because the answer is always yes. They're a human being sitting in front of me. Or if they say, oh, a bit, the fun part of dissociation, I guess, is I can dissociate and be aware of it, or I can dissociate and not be aware of the dissociation itself, if that makes sense.
Mm.
So I can't tell my therapist about it if I don't know it's happening. So again, in the session, like the therapy session, we might be observing dissociation, but interpreting it as an attentional issue or a slow processing issue if there's, auditory processing. So being really able to hone the skill of understanding dissociation as a concept and what it looks like in session can really help refine appropriate treatment. So we're not going off track for 6 months and then, oh gosh, because I've had supervisees who come, we've worked with this person for years and then they've understood there's a serious dissociative issue here, which would have been there the whole time, but they just haven't picked it up because it's so subtle. And that's not, their fault. We're just not taught enough about it in our studies, and that's a shame.
No, we're not taught, are we? And also, I think we're also taught that because it's quite complex and seen as quite scary, there's a sense, well, if we do have a client that is presenting with a dissociative disorder, we immediately need to refer on because it's beyond our scope.
Yes, the idea of a dissociative disorder being rare when I think it was for it to be rare, it has to be less than 1% of the population, like if it was a medical diagnosis, or that it is so extremely rare you might never see it at all in your practice across the career, where that's just not the case. Like dissociative identity disorder is more common than schizophrenia. And
Wow.
so if you think about, say, these clients are in deep distress and they go to a hospital to ED, a question often asked is, do you hear voices? Where the implication is schizophrenia, a hallucination, an auditory hallucination. If we have someone who's multiple, they are going to hear voices. So the answer is yes, but there's no follow-up question. So the assumption is, strangely, the rarer condition of schizophrenia or psychosis than dissociative identities. And so again, understanding that some of our questioning that we're taught has inherent implications that just don't match up to the prevalence rates that's in the DSM. Like in our therapy Bible, it's in there. It sometimes is confusing, why we're taught things that just seem inaccurate.
Wow, yeah, that's interesting, isn't it? That schizophrenia is less common.
Mm.
And when you think about the treatment for schizophrenia would be likely medication.
Can
That,
be significantly harmful. Again, so if this person is diagnosed, and I've had a few experiences with clients where they've had, decades of a diagnosis of schizophrenia, which is less than 1%. So I think the DSM says about 0.3 to 0.7 as a prevalence rate for schizophrenia, whereas DID is up to 1.6. So more than double the prevalence rate for DID than schizophrenia. But if we're medicating for schizophrenia, we're impacting neurochemicals for something that's half as likely, if that, I don't know numbers, but 0.7 at the higher end and 0.6 at the higher end. It just doesn't match up. And so there is real harm that can come about from medicating. And then we talk about, think about I've been diagnosed with schizophrenia and all the stigma that comes with that and the risks that come with that. And then the layer of if I don't have schizophrenia, I might be branded as treatment resistant. Not because I am, but I'm receiving the wrong treatment. And so I'm naturally going to be resistant to the wrong treatment, not because I'm malingering, it just is the wrong diagnosis.
wow, and all those years of receiving the wrong treatment and missing out on the right treatment as well.
Mm. And the internalized shame, and then the clients finally start to come to an understanding of their reality, and then the potential trauma that they've experienced of understanding that they've had this wrong diagnosis, they've ingested medications, they've done everything right, but it's actually been wrong. And so sometimes it could be years of just undoing that trauma before actually working on anything.
Mm. So even the treatment becomes traumatic itself.
Mm,
Yeah, yeah. And that's, I mean, that's, I guess, failing those individuals
mm,
in terms of what they need.
mm. So I
Yeah.
think understanding dissociation from the get-go so that we capture and assist these people
Mm.
from the beginning of our careers, because that's what we're here for, to help people.
Yeah, absolutely. And if we are then trained to recognize this, then the likelihood of misdiagnosis is going to be much less.
Mm,
And these individuals will receive the treatment that they need much, much earlier.
mm,
I love the way that you say it's sort of normal, and we all experience that to some degree. And my understanding of dissociation is also in its more extreme form, as it's usually some really necessary and protective strategy, and that the person has really put in place to survive some really terrible experiences, and it's enabled them to live their lives.
highly adaptable. So if we think of dissociation on that spectrum, is it kind of functional? Yes. In the moment where we experience the dissociation in the traumatic event, say, highly functional. It's helped that person survive whatever is going on when flight or fight is not an appropriate response. I was going to say choice, but it's not choice. Choice requires conscious awareness. So it is always functional and always helpful in the moment. When our brains continue to dissociate to that same degree, then it becomes disordered and dysfunctional. But that our treatment isn't to remove dissociation, as we might with, say, depression. We can't remove dissociation. It's a human experience. It's not about no longer dissociating. It's kind of bringing it down the spectrum to, as much as one can, to a more functional, appropriate um, frequency or intensity. So that's why it's also difficult, because unlike, say, anxiety disorders, do we want to, rid ourselves fully of anxiety? Do we want to rid ourselves fully of depression? There's some things that we don't want to rid ourselves. Dissociation is helpful.
Mm. Mm. Yeah, and acknowledging that that it is a helpful process, but like you say, in its most extreme form, it can also be quite debilitating for people. Um,
Mm. After the trauma is finished, after the trauma is over, there's no longer necessarily a need to dissociate to the same degree, and that the brain will likely continue to do that because that's just the neural path, like it's just learnt to do that as a way to survive. And so it's helping clients understand, again, validation and normalizing dissociation is such a crucial part of most of the first part of therapeutic treatment. But if we don't get what it is, we can't normalize it, especially if we're told it's super rare, we're never going to see dissociative disorders, not necessarily DID. Then we might be working with someone for a couple of years and inadvertently making our job harder, because then when we do pick it up and we start to normalize, the client might go, well, it's not what you said for the last 2 years. This doesn't make sense. And then there could be ruptures. So getting it right from the beginning is helpful for any time we're working with people.
yeah, and I guess that comes down to that thorough intake and assessment as well. And we are going to cover actually another episode on sort of screening and assessing for
Mm-hmm.
disorders, because I think that's an entire topic in
Mm,
itself. Because it is just so important to, as you say, to get that right as early as we can, so that we can not only provide the psychoeducation, but we can then also provide the right treatment and
mm,
not wrong treatment.
mm. And make sure that our formulation is accurate. If we see adults and they do have, a higher rate of dissociative experience, we might ask in our intake, tell me about childhood, tell me about adolescence, and they might not be able to recall because of the dissociative experience. And so we're missing out on why are they not able to recall? Is there a function to that? Or they might only be able to recall positive experiences because they've dissociated the unpleasant. And so if someone's reporting, yeah, childhood was pretty good, and we take that at face value, having not screened for dissociation, then we're missing out on a large part of maybe a lot of what they're coming to see me for is related to dissociation and childhood experiences. Now, there's a lot around trauma and attachment wounding. So there's so much that we might miss out on that could very much be a clincher of, that's that puzzle piece. And then we just look at it differently.
Yeah, yeah. So in terms of getting more information about dissociation, where would people go to learn more? How can they sort of educate themselves a little bit? Because hearing you say how important it is, where do we then go to get this basic education that helps, I guess, demystify it a little bit more and make it accessible?
Always supervision, because for me, that's you get that back and forth. There's a reciprocal nature of like learning and asking questions and having someone who's trauma trained. For me, there's a delineation between trauma informed, which is I understand trauma impacts a person. Okay, but are we trained in how that actually impacts a person? So a trauma trained therapist, but also looking at lived experience professionals. So we're getting both sides. The expertise is them being professionals, but their expertise is people who've experienced high levels of dissociation or more pathological. So Caroline with a Y, she's got lived experience with, dissociative disorder and is a professional in the UK. And she's got a lot of free resources and some paid trainings. Dr. Jamie Marich, their lived experience as well with dissociative disorder. They have fabulous resources. They have, a couple of things they put out on their social media. They have a book themselves of Dissociation Made Simple, audiobook if we don't like reading, but really kind of finding the resources from sources that have lived experience as an expertise and the professional experience captures it all. I have my own ebook I wrote a few years ago for folks who, if they're interested in working with DID, it's kind of like a welcome to, like, what is dissociation? What does it look like if we're working with dissociative identities? Not so much parts, like in terms of an IFS, which is more singular focus versus dissociative identities and multiplicity, but really making sure that we're seeking resources from reputable. It's obviously never Wikipedia. So if we Google it, what I like to do sometimes is Google and Scholar, and then if there are articles, see if those people who've written the articles, if they have websites or if they have other resources. So we know that they're actual researchers with expertise, and then again trying to find that extra of lived experience expertise.
Great. So I'll put those links into the notes so that people can access those. I'll get the link for your ebook as well, Jo, because that sounds like a great resource. And these are things that people can access, I guess, immediately, and then go to for further training. It sounds like the websites that you're recommending also have further training.
Yes, so like Caroline Spring has stuff that you can access immediately, like you just purchase, say, a class. Like Dr. Marich's books, they're immediate. You buy them or you get them on Audible. Same with mine, they're accessible immediately. And then you add the supervision on top of that so that you have not just the reading or the listening, but the ability to apply that knowledge to cases and clients.
Yeah, yeah. And you're a board approved supervisor as well.
Yes, I do supervision with folks who are early career and quite, senior in their career because this misinformation that, dissociative disorders like DID are so rare that they often come years into working with a client. Oh, It's multiplicity. Yep. Oh no, I should refer on. You've worked with them for 2 years, which means you can continue to work with them. It's about understanding the framework. Like once you get it, you're like, oh yeah, that's easy enough. It's just getting it right in your brain.
And that's great because it also means that those clients can stay working with you. I mean, if you've been
Mm,
seeing a client for 2 years and you're doing great work, but you're feeling stuck, my guess is that most clients will prefer to stay with somebody who was really keen to upskill.
mm. The
Um,
rapport. So if you
yeah,
work with the client for 2 years, they keep coming back. There's rapport there. That's a significant part of the treatment, outcome, like a positive outcome. And as you say, if there's a stuckness, is that I keep working with them and there's a resistance, either like an obvious active resistance or a stuckness? Is that because the treatment isn't quite right? And there's a facet of this client's experience I've not captured, like dissociation. And so reassess that kind of formulation. How is dissociation? So I'll just say now, everybody listening, take stock of who you're working with. How much are these people dissociating? Do we know, are they dissociating in session? What is their knowledge of dissociation? And kind of just think about that with the clients you're currently working with.
yeah. And I think, as you say, it's about all of us educating ourselves early on so
Mm,
that we can understand this. Because, I mean, I know myself, I hear the word dissociation so frequently, either in sessions or in supervision sessions. It comes up a lot,
mm,
but it's often not unpacked. I mean,
mm,
I've learned over the years to begin to unpack that much, much more and begin to look for that much more. But often, if we're not trained, we don't unpack it. And
mm,
it feels as though it's like someone saying, well, I'm depressed or I'm anxious. But we would go into that. We would want to understand that more because we want to be able to support our clients in the best way. But I love the fact that you've just given some really clear and simple ideas and some resources that people can go to. And if anybody is sitting here thinking, I've got a client and I'm not sure if they may have more dissociation, a high level of dissociation, then thinking about some supervision on that. And Joe's
mm,
somebody that would be, as you can hear, somebody that would be able to really support these types of presentations and support you in developing that confidence in that area.
mm. And I'm very wary that a lot of, you know, early career psychs aren't really able to afford the level of supervision that, say, we would cost. For me, being specialist isn't the right word. I always feel uncomfortable. Someone who has high level of knowledge in the area. So I do offer group supervision. So like buddy up so that the cost can be shared across to still be able to get, young psychs the level of knowledge that I think is needed without paying the full cost. So that's on my website if people are interested. And there are other supervisors, of course, but finding someone who's trauma trained beyond just informed. Because I think trauma informed is a competency. All psychologists registered in Australia are trauma informed because that just says we understand that trauma impacts the brain and a person. That's just basic level knowledge. What kind of training do folks have beyond that? It's really being, I don't know what the word is, but looking at who we're choosing for the type of information we're looking like to learn about.
Yeah, yeah, thank you. Now that's good to know as well for people because it then feels like it makes it more accessible. So I think we're going to leave it there for today, but thank you so much for coming on to talk to us. And we're going to be back with another episode around assessing dissociative disorders. So you can listen out for that one too.
Wonderful.
Thank you. Thank you for tuning in today. If you enjoyed this episode, please take a moment to leave us a 5-star rating. It really helps others find the show. And don't forget to follow us on Instagram at Between Two Psychs for more updates and resources. For more information and to explore everything we offer, head over to our website betweentwopsychs.com.au. We appreciate your support and we'll see you next time.